Some of you have had questions about where we are. So what I'm going to do is I'm actually going to go over this whole PowerPoint, and you are going to go through it again and make sure that you have filled in all the blanks to your notes. So the skeletal system as a whole, it has bones, cartilage, ligaments, and other tissue that stabilize and connect bones. We know that the skeletal makeup, we know that a ligament connects bone to bone and a tendon attaches a muscle to the bone. Cartilage is a connective tissue with a gelatinous mix. The cartilage that we are concerned with is the hyaline cartilage, and the hyaline cartilage is on the ends of each of the bones to further help protect and preserve the integrity of the bone. The skeletal system is supports, it stores calcium, it makes red blood cells which carry oxygen, so that's very important, protects our organs, and it also provides leverage for muscle movement. The skeletal system itself, the bone, is very vascular, meaning it has a lot of blood vessels, so it has to have blood supply constantly. Bones use oxygen. They actually do have waste, and they remove that as well through metabolism. And we also do have nerves in the bone. We do have a process called remodeling. So what happens is we get a new skeleton every few years. And we have these cells called osteoblasts, and the osteoblasts make new bone tissue, and osteoclasts actually come and they break down old bone tissue. As we get older, we have less blast and more clast, so we have more breakdown of bone, and we tend to have, that's why those older adults are more at risk for fractures, because they have more breakdown of that bone and a weaker bone tissue. Exercise stimulates the remodeling process in a good way. So that's why we tell all patients, even if they have osteoporosis, to maintain some sort of regular exercise. The good stress from exercise stimulates the bone tissue to get rid of the bad tissue and to make more of the good tissue. When we talked about aging, bones do become thinner and weaker due to increased bone breakdown and slowed bone regrowth. We worry about the elderly because they are more of a falls risk and they're a higher risk of fractures when they do fall. And then one of the most frequent causes of death in elderly is complications from a fracture. We have two different types of bone tissue. We have compact bone. Compact bone is that hard bone made of osteons, also called a bone cell. They're very tightly packed together. This is a very strong bone. You have blood vessels that fit through the canals in the bone. And then you have spongy bone. Spongy bone is at the ends of the long bones. So it's not as strong. It looks very porous. It has holes in it. But the important thing about it is that it contains red marrow. And your red marrow makes red blood cells, white blood cells, and platelets. The only thing on this slide that I want you to know is about the growth plate. The growth plate is an open plate surrounded by cartilage, and that is because as you grow, your bones need to get longer, obviously, to a certain extent. So our growth plate remains open until around our 20s to allow for that bone to stretch and to grow. When that growth plate closes, though, you're not going to get any taller. So there was a crash course that you were supposed to watch over types of joints. Joints are fluid-based areas where two bones connect. When joints start to degenerate or they're overworked, as we'll talk about here in a minute, that's when the two bones that are together, they start to grind on each other, and that joint just starts to become damaged and painful, and then we have to go in and replace it. On that crash course, you need to pay attention to that. And I've also given you a chart that I wrote out on the different types of joints. Basically, joints are classified by their function, and they're also classified by their structure. So these three that I'm going to talk to you about is their function. So how do they move? And with these, we have a diarthrosis, which is a freely movable joint. So an example is this ball and socket joint at the hip. Amphiarthrosis is slightly movable, so the spine. And synarthrosis is immovable. So these little joints that connect these two bones in the skull, those are pretty much obviously immovable to our benefit. So that is an example of a synarthrosis joint. On that chart, the other ones that you need to know are the 6 types of synovial joints and an example of them. So we're going to kind of break down different parts of the skeletal system. The first thing we're going to talk about is a long bone. Long bones are your femur, tibia, fibula, humerus, radius, ulna, some of your sternum, some of your ribs. They're just longer bones. The main part of a long bone, the middle, the main portion of it is called the diaphysis. The 2 ends of the long bone are called the epiphysis. Now, in the middle, in the diaphysis, the main part, we have something called the medullary canal. The medullary canal has what's called yellow marrow, and that's basically fat. This is why we worry about a fat embolus, so basically a clot made of fat flying off if we fracture a long bone in the right area because of that medullary canal. So we could have a fat clot and it could fly somewhere and cause a stroke or a heart attack or cause some sort of blockage of blood flow. At the ends of the long bone, we have that spongy bone, and in that spongy bone, we have red marrow. Red marrow makes blood cells, platelets, and some white blood cells. If you don't know what these do, on your notes, there's a vocab list. It's in blue. I suggest you look these up and make sure you know what they do. The reason why I'm telling you this is because this is where we diagnose blood disorders like leukemia, platelet disorders, things like that. We actually take a needle and we get into that spongy bone and we draw out some of that red marrow and we test it. It's called a bone marrow aspiration. So that was about the long bone. Now let's just talk about layers of the bone. So the outer, harder layer is called the periosteum. It's a very tough membrane that covers the outside of the bone. This is where it has blood vessels and new bone cells. And then I've told you about what an osteoblast is. The inside of the bone is called the endosteum. So endo means within. And then I've also given you an example or a definition of spongy bone again if you needed it. So let's talk about the pelvis. All right, the pelvis is basically your hip, that whole hip area. So we're going to talk about how the pelvis connects on the front and how the pelvis connects on the back. So on the back side, the pelvis, you have 2 hip bones, and those are called the os coxae. Okay, on the dorsal side, and this is the front side, but you can see. So on the dorsal or the back side, this is an os coxae, this is an os coxae, your 2 hip bones, and they fuse together on the back side through this sacrum. This is your sacrum, and this little bitty bone right here is your tailbone called the coccyx. On the ventral or the front side, you have your os coxae, and they actually fuse together through a little joint right here called the symphysis pubis. Now, there's a few things that I want to note about the pelvis. Okay, first of all, the top part of this pelvis is called the ilium. And then you have these holes right here. This is where blood vessels and nerves go through. So that's part of the reason, and there's a question on your notes, why a pelvic fracture is so dangerous, because you could, when you fracture, you run the risk of severing all those nerves and blood vessels. Each hip bone is made up of 3 regions, the ilium, ischium, and the pubis. I just want you to know the ilium is the top part and the pubis is the symphysis pubis, which is the joint where the two bones connect. So the pelvis itself has two sockets, it's like two holes, and that is called the acetabula. And that is where the ball portion, the top portion of that femur, goes into that hip joint. Okay? So, and that's really important because that kind of helps us further understand hip replacement and joint replacement. So, I'm going to kind of show you what I mean by that right here. This is a really good picture. So, here's your os coxae, your ilium, connected right here with the symphysis pubis. These are where blood vessels go, and then you have this, which is called the acetabulum or acetabula, and this is actually your femur. So your femur, remember I said there were 6 types of synovial joints. Your femur, your hip joint, is a ball and socket joint, and it's called that because it has this ball portion at the very top, and it connects in right here. So what happens is when this further wear goes through wear and tear, obesity, professional athletes, just that repetitive movement, that joint kind of degenerates and that cartilage wears off, and these two bones just rub against each other and further damage and inflame that bone. At that point, that's when we have to do a joint replacement. So what they do is they cut this whole portion of the bone off right here, and they show you kind of what it looks like, what they put in instead. So basically they rebuild. So that's, you can see, that's the knee right there. So you can see it's like a titanium. They actually rebuild that joint, and that's what they put back in. So anytime you hear joint replacement, that's what they're talking about. They take out that part and they're rebuilding it with titanium and putting it in. Here's an illustration of it. I highly recommend that you watch it. So let's talk about the spine, sternum, and the rib cage. So the spine itself has 26 bones. It's divided into 5 parts. We have pads of cartilage called the intervertebral disc that is in between each vertebral bone. This acts as a shock absorber and permits bending, twisting, and movement of the vertebral column. There is something on your notes called a herniated disc activity, and I'm going to tell you how to get to it and figure out what you need to do there. So it's talking about a herniated disc, also called a ruptured disc. You're going to see this quite a bit. Somebody has overpulled or overlifted, and they have ruptured or herniated their spinal disc. Basically what happens is a piece of the intervertebral disc or that shock absorber has slipped out a little further, or it has weakened or flattened, and then it causes those 2 vertebral bones to just basically place pressure on the spinal cord, because remember, the spinal cord goes all the way down through that vertebrae. So that's kind of an example. Do you see how this disc is bulged out right there, and it's putting pressure on the spinal cord? So it's important to note that the pain that you're going to see with this is nerve pain. Okay, it's not just like pain you can get and go away with Tylenol. Nerve pain is different. Nerve pain is numbness, tingling, stabbing, burning, all of those sensations. So massage therapy, heat and cold therapy, chiropractor rest, traction, where they kind of put you in a thing to realign your spine. If it's bad enough, they can do what's called a laminectomy, where they remove that damaged disc and they basically put in a fake one, just like a joint replacement. So I am going to, on today's instructions, I'm going to put the link to the herniated disc activity, or the video. You need to watch that, and that will give you the answers that you need. Some important things that you need to know. You need to know what the annulus fibrosus is, and you need to know what the nucleus pulposus is, and what comes out of the nucleus pulposus when the annulus fibrosus leaks or tears. So when we talk about the rib cage, we have 12 pairs of ribs. These ribs are connected through something called costal cartilage. This is cartilage right here. They connect to the sternum. These ribs that go from rib, cartilage, sternum, those are called true ribs. As you get down here, you have ribs that connect to the cartilage up above them. Those are called false ribs. And then down at the very bottom, and you don't really see them right here, but down at the very bottom, we have floating ribs. And floating ribs, they just attach to the spine and they have no attachment on the front. This right here is your breastbone. It's called the sternum. It has 3 parts: the manubrium, the body, and the xiphoid process. The reason why I'm telling you this is because the xiphoid process is a little piece of cartilage at the bottom. And the xiphoid process is very important in how to insert a feeding tube and to gauge how far you go. A feeding tube you will see a lot in a rehab setting because think about it, if they've had a stroke, we talked about aspiration and sometimes they need speech therapy before they can eat. They have to get nutrition, so we put a tube down their nose and it goes into their stomach and that delivers their nutrition, their food. So again, I'm going to put a video link on here on how to insert a feeding tube to kind of show you what I mean by the xiphoid process and why that is important. Oh, never mind. It's right here. So the last thing that we're going to talk about is the disorders of the skeletal system, the ones that I think are important for us to know. Arthritis. Anytime you see ITIS, that means inflammation. Arthro means joint. So anyone who has arthritis is inflammation of the joints. There are 2 different types. Osteoarthritis, osteo means bone, is the most common form you'll see. Most of the time you're going to see that in the hips and the knees. You can see it anywhere, obviously. But causes of arthritis: overuse of joints, so professional athletes, or just someone who has a really physically demanding job and does the same kind of movement over and over again over time. Obesity: the more weight you have on your joints that shouldn't be there, the more stress you put on them. Injury, and then just genetics. So what you're going to see with arthritis as a whole, either type, is joint pain, stiffness, aching, and limited range of motion. You will see some deformity too. So this lady right here has arthritis of her fingers, and you can see kind of these nodules coming out. You'll see a lot of deformity, especially the wrists and the fingers. So this is a normal knee. You see all this nice hyaline cartilage here. And this is an arthritic knee. So again, the same thing happens as what happened in the hip. This cartilage wears away. The bones start to grind together and cause more inflammation. And at that point, we would end up getting a knee replacement. So anytime you have inflammation throughout this semester, you're going to think price, protection, protect that joint, rest it, is R. I is ice. Remember, cold therapy decreases pain and swelling to the area, decreases that inflammation. C, compression, rapid to control that swelling. And E is elevation if it's applicable. Some other things, we may do heat therapy in the beginning. Maybe they're doing physical therapy. We may do heat therapy to loosen that joint so they can do their range of motion and then follow it with cold therapy afterward. Anti-inflammatory medications and steroid injections to decrease that inflammation. We have some things that we always encourage: exercise. So here's some things that are low impact on the joints that we would encourage. Walking and swimming are always a very good go-to because they're good cardio, they're good exercise, but they are low impact on the joints. Rheumatoid arthritis is different. Rheumatoid arthritis is caused from the immune system, so it's typically genetic. And what happens is the immune system, it's an autoimmune disorder. Autoimmune means the immune system attacks the body. And the immune system actually just attacks your joints and causes that arthritis. Typically, you're going to see this at a young age. Kids start to have it. Usually, if you see a child with arthritis, they have rheumatoid arthritis. Symptoms and treatment are the same, other than they probably take some autoimmune medication too. Okay, bursitis. So we have something called a bursa sac, and it's a little fluid sac that surrounds some of the joints in our body, not all of them. So our shoulders, our hip, elbow, and knees, they have a bursa sac, a little fluid sac that surrounds that joint. And over time, just like the joint and the cartilage itself, repetitive movements, injury, things like that can cause something called bursitis, where that little sac around the joint becomes inflamed. So some things that you'll see that are a little different with this one compared to arthritis, it's going to be very severe pain. Like all of a sudden you have really terrible pain. You're going to have a whole lot of swelling. So let's say you got it of the knee. You would like wake up and your knee was just absolutely huge. Okay. So it's going to look different than arthritis. This is more of an acute or short-term thing. So one of the things that most often they do is they'll take you like to KOC. So here's your bursa sac, here's your joint, this is the shoulder. So this bursa sac is inflamed, and you have all this. So anytime you have inflammation, you have more fluid that comes to that area. So what they'll do is they'll take a needle, it's called a needle aspiration, and they'll draw out that excess fluid to relieve the joint. Again, physical therapy, rest, steroids. This is the most common, especially if there's a ton of swelling there. And then it may be fine, and then it may be like a chronic thing, like every few months, like you just get that bursitis again, and you just go get the fluid removed. So a fracture, you should know from health science, is a break in the bone, and there are lots of different types of fractures. If we have a fracture, so a fracture can be a crack, it can be a bend, it could be a full-on break. Immediately when you see someone that you think has a fracture, number one, check for circulation below the area. So if I think I fractured my femur, I'm going to look, do they have circulation on their foot? Things that tell me if they have circulation. The color of their extremity should be pink. It shouldn't be pale or blue. They should be able to kind of wiggle their toes. They should have sensation. They should have, it should be warm temperature. I shouldn't have a pale, cold foot. I should be able to feel a pulse. What I'm going to do is I'm going to splint that extremity in the position I found it in. I'm not going to try to correct it. I'm not going to try to straighten it. I'm going to take some hard pieces of something. Sometimes you can use cardboard, and you're going to take that and just wrap it or do whatever you need to do to secure that to where that extremity doesn't move. The more a fractured extremity moves, the more risk I have to sever blood vessels and to do nerve damage. And then I'm going to remember my PRICE acronym. We don't need to worry about those three. Okay, dislocation. Dislocation is different from a fracture. A dislocation, you are not, you're not breaking a bone. Where your two joints meet and where that joint, one of the bones just pops out of alignment in that joint. The same thing happens. You're going to see the same thing. So here's your knee right here. That's in alignment. And so here's your patella. Here's your femur. And then, your tibia. Here's your femur. And your femur has just slid back out of line with that joint. Same thing. You're going to splint it. Remember PRICE. We're not going to try to put it back into place. That's for the orthopedic surgeon to do. Osteoporosis, you're going to see in probably 90% of your patients in a rehab setting. It is a disorder caused by, it could be a lot of things, but basically your bones are brittle. Okay, your bones are weak and you are more at risk for a fracture. Like I'm talking like you bend over and then you straighten your back up and you fracture your back. Okay, could be a hormone deficiency. Um, Osteoporosis is more common in white, thin-framed women. We don't know why; it just is. So as women get older, they lose estrogen. Estrogen helps with your bone strength, lack of calcium in your diet. All of those things can cause it. And how they diagnose this is you start to have a lot of frequent fractures. So with an osteoporosis patient, sometimes we do hormone replacement if that's the problem. We do encourage vitamin D and calcium in their diet, both of these. There are medications like nose sprays and shots that you can get to help with your bone mass. We do always encourage exercise to help with that osteoblast process. So we would encourage walking or swimming because it's very low impact. Diet high in calcium, so obviously milk and dairy, but some other things if they don't like milk or dairy. Dark green leafy vegetables that come in those fancy salads sometimes, those have a lot of calcium in them. Okay, that is in a nutshell the skeletal system. If you don't fill in your notes and you don't listen to this, hopefully, if you're at this point, you have listened to this, then you're not going to do well on this test. This is me talking to you about everything that I would talk to you about if I was in person in class. So make sure that your notes are filled out and make sure that you are looking at your bone labeling diagram. You're looking at the chart that I made on the types of joints and that you're watching the video on feeding tube and herniated disc.